Hello, good afternoon. I'm Francisco Ramos Gomez. I'm chair and professor of the Department of Preventive and Restorative Oral Health Sciences at UCLA School of Dentistry, and I'm delighted to have this afternoon our very prestigious Dr. Bert Edelstein. Dr. Edelstein is a professor emeritus of dental medicine, pediatric dentistry, and health policy and management at Columbia University. Until his retirement in June 2021, he chaired a section of population oral health at the Columbia University College of Dental Medicine. He has served as senior fellow in public policy and president emeritus of the DC-based Children's Dental Health Project, or CDHP, a nonprofit policy organization he founded in 1997 to advance policy to benefit the oral health interests of children and their families. A board-certified pediatric dentist and board-eligible dental public health specialist, Dr. Edelstein practiced pediatric dentistry in Connecticut and taught at Harvard before relocating to Washington, D.C. to serve as the Robert Wood Johnson Health Policy Fellow and the Health Legislative Aide to the U.S. Senate Minority Leader. He contributed to the U.S. Surgeon General's Oral Health in America report, led the Surgeon General's workshop on children and oral health, and managed a federal interagency oral health initiative. He has participated in 4 Institute of Medicine projects, testified before Congress multiple times on dental care for children, and provided support to Government Accountability Office dental studies. From 2009 to 2014, he served on the Federal Medicaid and CHIP Payment and Access Commission that advises Congress, agencies, and states on Medicaid and CHIP policy. At Columbia, Bert leads an interdisciplinary early childhood caries prevention and innovation study and directs federal training grants for predoctoral students. That includes the DDS MPH Scholars Program, postdoctoral pediatric dentistry fellows for faculty development, and AGD fellows in the care of people living with HIV/AIDS. His academic and consulting contributions focus on public policies that affect children's oral health and their access to care. Through the Children's Dental Health Project, he has helped secure legislation and regulation for dental coverage in CHIP and health reform. While protecting the dental benefit in Medicaid, his more than 100 publications include contributions to the peer-reviewed dental literature, book chapters, commission papers, and policy documents. So as you know, we're so pleased and so grateful to have Dr. Edelstein. He's really the godfather of public policy. So I want to start by asking you if you can please give us some of your thoughts about why is it important to get involved at the local level and also at the federal level. If I'm a professional, how should we really be interested in getting more into doing this advocacy for children's oral health? Bert.
Francisco, thanks. Thanks so much for asking me, and thanks for your thoughtful question. I think it's important to recognize that as pediatric dentists, we are recognized by not only our patients, but by our communities and by policymakers as unique experts, that we know about kids' oral health in ways that other people don't. And for that reason, we have the capacity to speak up on behalf of not just the profession, but speak up on behalf of the patients, the families, the caregivers, the systems that address pediatric oral health and dental care. With regard to involvement at the local level, I think it's important to recognize that while our professional associations do a terrific job advocating on behalf of the profession in Washington and even in some state houses, that a lot of decisions that impact practice, that impact children's oral health, that impact the future of our profession, happen at the local level. Decisions are made by school boards, they're made by local town councils, they're made by people who are not in government, but nonetheless establish rules for how we practice. So that would be educators, health systems, any place where we interface that we can speak up. So importantly, as pediatric dentists, we are recognized for our expertise. If we then leverage that expertise to speak up, we have the opportunity to be effective.
Well, that's a great, great introduction to our course that we're planning for policy and advocacy. So what do you think is required for effective involvement from our residents and our faculty in advocacy effort initiatives?
Well, building on my prior response, the first thing is to believe that you have standing, that you actually are a person who policymakers can trust. Policymakers come from all kinds of disciplines. They may be educators, they may be, one very influential policymaker is a pest control person. They may be lawyers. They come from all kinds of backgrounds, but they don't come from our background. And for that reason, we do need to help them understand what needs doing. So in a single word, I would say that what would make a dental trainee or a practicing dentist or even a retired dentist an effective advocate is persistence. And after that, I would add persistence, 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 and persistence. The other elements are that you have a concerted effort, that you're consistent, that you're responsive. Because remember, they need to make decisions and they need to function within requirements for their job. And we need to be readily available and quick to respond to them. In being quick, we also have to be accurate and truthful. And one of the mistakes that people make when they do have contact with policymakers or policymakers' staff is to make stuff up as they go, and that does not work. There is nothing better when you're not sure of something than to say, I don't know, I'm not sure, but I will find out and I will be back to you within 24 hours. So it's concerted, consistent, ongoing engagement that makes for effective advocacy.
Those are really great, great points. It seems to me that a lot of our profession, students and future dentists, they really don't really understand why they have to engage policymakers. Could you please maybe—
That one's easy. That one's easy. Because we all live and practice and function under the rules that are established by people who have been granted authority to make rules. Whether that's our dean for graduation, or whether that's CODA for certifying dental schools, or postdoctoral programs, or whether that's policymakers in government. All of those people set agendas, make rules that we all have to subscribe to. If we don't provide our input, then those rules may not meet our needs as well. And one more thing I wanted to add about effective advocacy, there's much to learn to do it well. And let's just call that learning the ropes. Need to learn who to approach, when, with what kinds of arguments, what kinds of places are involved, what kind of processes are involved. And I hope during our brief time together today, we'll talk on some of those options and opportunities because there's a whole bag full of tools and tricks. And when you know those tools and tricks and use them appropriately, then you are seen as somebody who is reliable and helpful. And I want to make a quick distinction here between advocacy and policy support. Too often, advocates are regarded as so committed and concerned about their particular issue that they're sort of out of bounds. They don't consider the opportunities as they really exist or the constraints that the policymakers are under. And so they just keep pushing, pushing, pushing for what they want without stopping to think about what the policymaker needs. And so advocates do sometimes have a bad name, whereas policy wonks or people who develop policy or support policymaking and are responsive to policymakers, they're the ones who get listened to.
That's very nice description of of this complex, but very understanding piece. Will you please tell me a little bit, these folks, these policymakers, it seems to me that they're bombarded with 100 requests from everything, you name it, from environment, from, taxes, from you name it, right? So what can you tell us, or what kind of advice you can give us to bring our issue to the forefront? How can we really be effective advocates for our profession and our specialty, especially on behalf of our pediatric patients?
Another great question, and I want to use a little anecdote to bolster exactly what you said. When I first Senator Daschle's office, in order to help me understand the operation of the office and get to know the people in the office, my very first day, I was in the mailroom, and the mail was delivered 3 to 5 times a day, each time in a large laundry cart. And the volume of written requests for the office was just tremendous, overwhelming. And as I would thumb through the materials sent to Senator Daschle's office, I would see the full range of issues that his office needs to address. Health was but one issue. Oral health is a subset of health. Pediatric oral health is a subset of oral health. And dental care is a subset of pediatric oral health. So by the time you get down to the level of pediatric dental care, you're already swimming upstream against layers of considerations. Another quick anecdote. The first memo that I wrote for the senator, I thought quite dense and quite specific, but it was 3 pages long. It was handed back to me and I was asked to make it less than 1 page. What that told me was 2 things. Number one, the senator had an awful lot on his plate other than my concern or the issue I was tasked with. And number 2, that he was trusting in his staff to give him accurate information without any commas, without any subclauses that were providing detail beyond what he needed to know. So in answer to your question, how do you get to have your voice heard is your essential question, yes?
Yes.
Okay.
Especially because dental and mental, it seems like we're the stepchild of policymakers, and when it comes to any focus.
Yes. Okay, so number one is talking to the right person. If the policymaker does not have jurisdiction that relates to your concern, they cannot dedicate time and energy to your concern. But if the person does have direct responsibility, either by way of a committee assignment or because of a particular charge that they have given themselves, then you have an open audience. So that's number one. Number two is to understand what they're up to at the moment. What is their concern? What do they need to know in order to function for what they're doing at the moment? Are they developing legislation? Are they writing to the administration trying to clarify some executive branch action? Are they planning a hearing? Are they exploring an issue for the first time? Each of those things will tell you which kind of door you walk through to talk to them. Third thing, what other committees or assignments or responsibilities do they have? So for example, once when bringing the issue of pediatric oral health to a very, very conservative legislator who happened to sit on the Military Readiness Committee and had no concern about pediatric oral health whatsoever, she became interested when I told her that DOD data, and I presented the DOD data showed that the most common reason that active duty soldiers leave their duty post is for dental troubles. Then she had an interest. She had immediate interest. She didn't care about social welfare policy. She didn't care about health policy. She didn't care about general population needs. She cared about military readiness. And so I found a hook
Yes.
attract her interest. So that's the next thing. The right person at the right time with the right issue. Now, I would suggest that thanks to over 20 years now since the founding of the Children's Dental Health Project, pediatric oral health has become a bona fide, accepted area of health interest to legislators and executive branch officials who deal with health issues, especially children's health issues. So the field is fertile, but the opportunity has to be perfectly tailored. The last thing is that once you've made that connection, back to the 4 elements of successful advocacy, and they are persistence, 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 persistence. So persistence starts with a very specific ask to know what it is you want. If it's very clear that what you want is not what they want and not acceptable to them, then you have to listen carefully to what is of interest to them and match what you have to say to their interest. Hold on one moment. Okay. The next thing about persistence is that once you've made your ask, you cannot allow yourself to be gently but firmly rebuffed. Policymakers and their staff have visits one after another, after another, after another, after another, all day long from people asking for things. And the easiest thing to do as a staffer, and what I was trained to do, is to thank people for coming, tell them how much you appreciate them, tell them how much you value them, tell them how you're going to bring their issue to your boss and discuss it, and hope they never follow up. Because if they never follow up, you don't have to follow up, and your list of things you have to cover is so large, your to-do list is so long, that anything that doesn't require follow-up, you don't follow up. So yes, Congress, state houses, legislators, one of the best places to talk to state legislators is when you have their child in your chair.
Of course.
Because they're not there as state legislators and they're focused on kids' oral health at the moment. Or when they do a town meeting and you work with their staff to ask about having that person talk about kids' oral health at the town meeting. If I could, a quick anecdote about that.
Yes.
Feingold was a populist in the sense that he believed that he needed to truly represent his constituencies. He was one of the few US senators sitting who attended every single county in his state, seeking input on policy from constituents. So you're not only a pediatric dentist, you're a constituent. So there's an opportunity there. But of interest, after years of doing this, he decided that he would ask about health issues as a focus for these meetings one year. And he asked about health issues, and he expected to get what he usually got. But this time, somebody raised dental care as a particular problem. And all of a sudden, everybody wanted to talk about dental care and the difficulties they were having accessing care or affording care or problems with their insurance. At the next county he went to, he said, we're here today to talk about health, and I don't want to forget about oral health as well. The whole meeting turned into a discussion of oral health. His salience became so severe, so extreme, that he came back to Washington. He contacted the Children's Dental Health Project, and he asked for ideas for legislation. Those ideas for legislation became a bill that he proposed. It became inserted into a larger bill. It was passed, it was signed into law, and it became the State Oral Health Workforce Grant Program.
Wow.
It's been around for a couple of decades.
Those are the kinds of things that, the hook that you mentioned is so essential, because we've had experiences as well where you go there and the staffers are millennials that are wonderful, or Generation Zs, And they have never experienced what is dental pain themselves.
And they have beautiful teeth.
Yes.
And they think that dentistry is about cosmetics and about brushing your teeth.
Exactly. And braces.
Now, this has been a problem, a significant problem. One senator who truly valued all health issues could not get focused on oral health. We worked with his staff. We provided data. We had constituents come and explain the problems they were having. Nothing seemed to budge. Finally, in a one-on-one meeting in his hideaway, he told me quite honestly, one-on-one, that he didn't believe oral health was a problem, despite the materials we had provided for him, and that he saw it as essentially an aesthetic issue. Mm-hmm. So when we asked him to champion a dental benefit for pregnant women in Medicaid, because many states don't cover adults with dental care, and their Medicaid programs don't make exceptions for pregnant women. We asked for a federal charge, which would ultimately become a mandate for dental services for pregnant women in Medicaid.
Absolutely.
No interest. So then we said, well, how about kids with disabilities who age out of Medicaid? So they lose their EPSDT dental benefit, and at 21, they no longer have a dental benefit. What about them? Because they're still disabled kids. No, that didn't catch either. And so one of our to date unsuccessful efforts has been to get a Medicaid mandate for adults with developmental disabilities and intellectual disabilities.
Absolutely. These are such an essential kind of common sense things that I really hope we can really elaborate about, that you have to find maybe either a connection with the person you're trying to convey as advocate, right? That you live in the area where they're from, or you have some connectivity in their community, or you work in any of the health centers from where the congressmen or women are from, and just try to do these connections so it can become more real. But the hook, I think, is something that people have to have this kind of third eye to see, how can I really bring us a different level that we can relate, if it's not just from dental directly, but some other things. So you can have this continuity that you're talking about.
And back to those millennials, they are the gatekeepers.
Yes.
And they're the gatekeepers in state houses, they're the gatekeepers in the federal government. On the executive side, you have career bureaucrats who have tried valiantly for years to do all kinds of good things and have confronted the realities of finance or politics or whatever it is that gets in the way. Don't count them out. They are the people.
Absolutely.
And the career bureaucrats are the people who get you where you need to go. And when you're talking to a millennial, a young congressional staffer, keep in mind, they got there because they're articulate, they're bright, they're capable, and they prepare information for their supervisors, who then roll that into information for the boss.
Absolutely.
Later.
And in addition, if they believe in your cause, they're going to make it a priority. From the 100 things, they're going to bring it to the top, which is such an essential piece.
And the other hook that we have as pediatric dentists, which I've already mentioned, but I want to reinforce it, is a patient in the chair who is the child of somebody who may be a lobbyist, or somebody who may be a legislator, or may be on the town council, or may be on the school board, or may sit on a insurance company board. Those people have a vested and sincere interest in kids' oral health. Need to find a way to leverage that. But there are other ways as well. Letters to the editor. Every state and federal official is monitoring letters to the editor in their local newspaper. It doesn't have to be the New York Times. Dear colleague letters, when you have a member who gets really interested in your issue, work with their staff for that policymaker, for her to then write a letter to other legislators. They're called Dear Colleague letters.
Yes.
To raise issues. Hearings and briefings. There's a big difference between hearings and briefings.
Yeah.
Hearings are formal elements of the legislative process or sometimes of the executive branch process, whereas briefings are informal. And you can set up a briefing with not just yourself as the pediatric dentist, but then think about who are all the people who the legislator or the executive branch bureaucrat might want to hear from on the issue. So you're going to invite somebody from the hospital, somebody from local advocacy organizations, somebody from the safety net. And you're going to work hard with those people to get your message clear and straight and consistent. Nothing is easier on a legislator or a legislator's office than being presented with conflicting information, because then what they do is they simply say to you, hey, you guys are the experts, we're not. You go figure it out, and when you've got yourself on the same page, come back and talk to us. I remember the very first meeting that I staffed with Senator Daschle one-on-one was about a nursing issue. And there were 4 different nursing organizations, national nursing organizations in the room. 3 of them presented the same argument. The 4th presented a completely different argument. And as gently and politely as he could possibly be, he said, this is obviously really complicated. Why don't you folks go back and work together? And when you've got a single recommendation, I'm ready to hear you.
Wow.
So come back.
So there you go. This is a very clear message to our constituents, our great residents, students, and fellows. Don't miss an opportunity, but speak with one voice, speak with one message, and be very clear in what you're trying to convey and what you want to get out of the visit, right?
But there's a catch. The catch.
There's always a catch. There's always a catch.
The catch is that there's somebody who's also meeting with the legislator who is providing a coherent, consistent, persistent argument antithetical to yours, opposite of yours. That's the problem.
We surely were not aware of that piece.
You need to be aware of it. And what you need to do is, just like a litigator prepares for court, prepare very well by knowing what your opponent is going to argue. And be prepared in your initial short presentation, your pithy, focused presentation, be prepared to refute what you know other people are arguing against you.
Do you have any examples of that?
Sure. So, the Children's Health Insurance Program was enacted with no mandate for dental coverage. Rather, the legislation allowed states to elect whether or not to provide dental coverage to these working poor family children. Children's Dental Health Project was founded with an initial purpose, a sole purpose, of getting all 50 states to elect the elective dental benefit, so that we could then go back to Congress and say, since you're going to reauthorize Children's Health Insurance Program every 5 years, or every 10 years, I'm sorry, I've forgotten, but since it's going to be reauthorized, and all 50 states have already elected dental care, why don't you just make it a requirement? We won't even call it a mandate, because you don't like mandates. We'll call it a requirement, because all you're doing is reflecting what the states have already done. Okay, so we went back to Congress and we said, all 50 states have already done this. Let's put it in the federal legislation. I think that's an example of what you just asked for.
Yes, yes, that's exactly right. To be always aware of your points, but also what will be your counterpoints, so you have a way to address them properly. Be
And by the
prepared.
way, the reason it became elective
Mhm.
in the first place is because the Medicaid dental benefit itself is elective, except for the special pediatric coverage benefit called EPSDT, Early and Periodic Screening, Diagnostic, and Treatment Services. EPSDT is the pediatric health benefit in Medicaid, which inherently requires dental. But Medicaid itself, in the legislation, does not require dental. And that's why it varies for adults state by state. So what legislators do when they write new legislation is they look at old legislation and they copy it. So they looked at old legislation that said that dental was elective or optional, and they made that elective or optional in CHIP. But we were able to reverse that over time.
Absolutely. And let me tell you
Over
that.
time.
Let me tell you that, yeah, absolutely. Let me tell you that your brilliancy with CVHP is something that we all look after, and we got guidance. I mean, it was such an incredible, it really moved the agenda forward, more than we ever thought. So can you maybe mention some of the great accomplishments in your tenure on CVHP as well?
For one thing, I think the fact that at our maximum, we had 7 staff pretty well, and one person was strictly administrative. So we had 6 content staff. I think you can see from that it is possible to have influential advocacy and policy support with a very small budget and a very small staff. When I hired the first staff person and asked her how she would know she's succeeding with legislators, legislative offices, she said, when I get called more often for help than I call them for an ask. Because that means they recognize your value and they're seeking your help. What happened then was that when the ADA, a monster organization with big membership and lots of money and paid lobbyists, would visit the Hill, we would get a call and we'd be asked, ADA was here just now with a request. What do you think about their request? We loved those calls because we had already worked with the ADA to make sure that we were going to be consistent.
All the stars were lining up, pretty much. And that's the kind of strategy that we need to start thinking to the future. How can we really position ourselves for all these residents and fellows that will do advocacy work to be the source or the resource for any pediatric dental question they might have, that they can come to us, right?
And it's critical that you work with a community of people so that as many people asking requests are asking the same request. Mm-hmm. From a advocacy group for people with IDDD, or whether it's coming from a hospital association, or whether it's coming from a pharmacy group, or whether it's coming from a foundation. The critical thing is to have consensus. That can be very, very trying. That can be very, very difficult. I remember, for example, sitting down with 5 or 6 different dental organizations and trying to get to a single ask. There was a fair amount of negotiation that was necessary so that people could be comfortable. And there was a fair amount of cutting things out that people felt were very important, but we're going to muddy the issue at hand. So there's coverage issues, there's payment issues, there's workforce issues, there's safety net issues, there's education issues, there's delivery issues,
you
there's
name it.
issues.
Everything.
And as a pediatric dentist who has to deal with all those issues, you tend to want to just go in and spill your guts with everything you know.
Yes.
But it doesn't work because there's too much noise in the environment.
Exactly. be very clear, be prepared, and be concise, right?
And I mentioned hearings and briefings. One thing to know about hearings is that they're all theater. The questions have been vetted with the people being asked, and the answers have been vetted with the people asking the questions. So it's rare, but it happens, but it's rare for a legislator to suddenly ask a question that's completely off the wall. For example, there was a California state legislator who, after hearing my testimony at a formal hearing, said, Dr. Edelstein, is it not true that fluoride is being imposed on our underserved populations to harm their intellectual capabilities? Well, that was a
bomb,
out of the box, unanticipated question. Another one came from, and I'm happy to share his name because everybody knows his character, and he is a character, but he's a wonderful help for dental advocacy, and that's Bernie Sanders. Bernie Sanders had a stone in his shoe about something the American Dental Association had done. So he asked a question that was not anticipated, asking me to criticize the ADA, to counter the ADA. And I chose not to do so.
Very smart of you.
So is that we needed the whole community together.
Yes.
And he brushed me off. He said, oh, well, I guess you're not going to answer my question. That was fine. It was better not to answer his question.
Yes.
Get into a tit for tat kind of thing that would harm our capacity to work collaboratively.
Absolutely. Well, these are amazing pointers. It's been a delightful session. You are really someone that we always look after. And thank you, Dr. Edelstein, for all you have done, you're doing, and you continue doing on advocacy and policy. I don't know if you have any last thoughts on a take-home message for our wonderful residents and fellows that will be doing some of this advocacy work in the very near future.
My kind of sum up thought is that for the rank and file pediatric dentist trainee or practitioner, the world of policymaking seems abstruse, opaque. It's easy to criticize because what you see in the news is often noise and nonsense. And it kind of devalues your energy.
Yes.
In fact, terrific people are doing terrific work every day from different political perspectives and different policy perspectives, but they're not uncaring, and they need you as much as you need them. You just have to do a lot of homework to get to know it, and don't just rely on paid professional lobbyists.
Mm-hmm.
Because
no one is going to do it better than you.
No one, because you are the real McCoy. You are the
yeah. You know the issues. You've been there, done that. You're living them daily. We're right there on the benches. We know what we're talking about.
Exactly. And don't be apologetic. Don't be dismissive. Be persistent. Know what you're after. Make sure you've got your ducks in a row. Make sure you're working with the people who have a chance to actually help you, and then just help them. That's it.
And be yourself, right?
Absolutely. No reason to be apprehensive. No reason to be intimidated. A guy who's managed a pest control company and became a member of Congress still doesn't know much about pediatric oral health, and you do.
There you go. Well, thank you, Dr. Edelstein.
Francisco, thank you so much, and thanks for all that you and your colleagues are doing. Much appreciated.
The same to you. Many thanks.